Well, people are talking more about healthcare these days than I can ever remember, and we're launching a new series today called Healthy at Home.
When it comes to our health, we'd rather not be in a hospital, but at home. That begs the question, what do you do about things like IV infusions, wound care, or vital sign monitoring?
Well, with us this morning, Jessica Shaban, who owns Advanced Home Healthcare, the first of many visits. We're excited about these visits because, you know, healthcare is such, it's top of mind right now. So let's start out. Tell us a little bit about your company.
Well, Advanced Home Healthcare is a company that I started, and it basically covers the gamut of all adult care, first and foremost senior care, and it offers services such as companion care all the way up to advanced skilled nursing services. But it's important to know that we also serve adults, maybe even expectant mothers who are bedridden because they've been put on bed rest, or adults with developmental disabilities, and we also offer transportation services and home modifications.
Yeah, well, as a nurse, you saw a need for the sort of business you've created. So why did you start it? What was the catalyst, Jessica?
Well, basically, there are many different forms of nursing that people can get into, and I was in a critical care unit at a very busy hospital, and one thing that I recognized was that my patients were craving more of my attention because they were scared about their condition and they just wanted some more answers and they wanted somebody to listen to them more. But as you know, in a busy hospital setting, that just wasn't possible. So I just had it in my mind that if I started this company, I would be able to offer that service to people and spend as much time as I wanted with them and just give them the education and the information that they craved.
Yeah, and you're dedicated toward delivering that personal attention and
Absolutely.
building those relationships and making sure your patients do better. I guess, is that what really sets you apart from other companies out there?
Absolutely. Yeah, we offer so many services though, and that's also what sets us apart. There are companies out there that just offer companion care or just offer skilled nursing, but we offer the whole gamut. Like I said, anything as easy as checking in on mom to make sure she's okay, all the way up to the advanced skilled nursing part of it. But it's also important to remember, you know, we're a local company and we aren't corporately owned. So we have very low overhead and we're able to pass on that savings with very competitive prices.
How does someone get started if they feel like they need your services? Does it have to come through a doctor referral, or can an individual or maybe a relative call you?
All of the above. But the first thing they should do is contact me or have a loved one or, like you said, a caretaker, contact me. From that point, there are certain steps that we take to initiate the process. We get to know the patient, and I offer a free initial consultation where I meet with the patient. No matter how long it takes, it's free.
Well, at some point, families have to make a decision whether to put their loved one in an assisted living home or a nursing home. How do you guys compare to those type of facilities? And can we keep our loved ones out of those type of places?
Independence is so important as we age.
Absolutely. Yeah. Our main goal is to help the patient maintain their independence and stay in their homes, because research has shown that being in the home fosters a more healing and comfortable environment for the patient. You know, you got to remember, some of these patients have been in their homes for many years. This is where they started out their young lives. They may have pets at home that, you know, give them a sense of purpose, and they love them and they don't want to give them up to move out. And also, moving can be a great source of stress for these people, and stress, as you know,
it's not good for your health.
No,
especially when you're trying to recover.
Absolutely.
Yeah. As you're coming into people's homes, trust is also important to know that, okay, nothing's going to go missing, and you know who's coming in, and you establish that trust with families. That's a big priority for you.
Absolutely. And during that initial consultation, that's one thing I really focus on, is building that relationship and building a rapport. But more importantly, I try to only hire people that I've personally worked with or my sphere of influence has personally worked with and can vouch for. And we also go through a very rigorous background check. References are always verified, and drug screening.
Yeah, talk about the consultation process. If somebody want to contact you, what's the process that they go through in getting the free consultation?
Well, like I said earlier, the first thing they want to do is call me, contact me. I'm available via email, fax, text, and good old-fashioned phone call. So if they just call me up, I'll set up a consultation, go to the home, and what I do is a patient assessment and an environmental assessment, because there are simple things that we can change about the environment via home modification that can help maintain their safety and keep them in the home.
So maybe it's a wheelchair ramp,
Absolutely.
stability bars, it could be a range of anything.
Absolutely.
It doesn't just have to be sort of the skilled nursing that you spoke about earlier.
No.
The phone number is 490-3120. The email address is advancedcareomaha@gmail.com. And then the website you're looking at there, there's a great video that Jessica did put together and posted online that sort of walks through some more specifics that we haven't covered here today. Also on social media, Twitter and Facebook. So you're not kidding, you are everywhere. And I think it's such an important subject. You know, I've talked to you, my mom is a home health nurse. And so the work is so valuable. And for those sons and daughters who are concerned about their aging parents, this is peace of mind.
Absolutely. And oftentimes the sons and the daughters want to maintain that role as son or daughter, and they don't want to have to be the ones, you know, to make the tough decisions as far as taking care of mom. They just want to maintain their original role.
Yeah,
And
that's a good
even if
point.
they have the skills.
Absolutely.
You know, 'cause what you bring, that's part of it too. Thank you, Jessica, for coming in. We look forward to your future visits too.
Thank
Thanks,
you.
Jessica. We'll see you
Thanks.
soon. All right, Coleman.